Hello, I'm Brian Everly, Risk and Safety Manager for Keystone Quality Transport. As part of our commitment to safety, we are providing powered air purifying respirators, or PAPRs, to some crews during transport of COVID-19 patients. These PAPRs offer a higher level of filtration than a standard N95 mask, are easier for a wider variety of employees to obtain a good fit, and have the added advantage of keeping the wearer cooler and more comfortable as they provide patient care. In this training, we will introduce the PAPRs, explain how they work, and then show how to use them in conjunction with full PPE donning, or putting on, and doffing, or taking off, as well as the decon process. If you have any questions, please see your supervisor, a member of the clinical team, or a member of the safety department. We join our crews who have already arrived on scene and received a report. The patient is either confirmed or has a high suspicion of infectious disease. The use of PAPRs is recommended. The support team has arrived on scene, done a complete check of the support kit and PAPRs, and donned their PPE. If the support crew will not be exposed to the patient, they do not need to don their PPE. For the purposes of this video, we will assume that they will have contact with the patient and show them in full PPE during the donning process. Let's join them now as they begin.
The first step is to have the crew remove any personal items that could interfere with the protective equipment. This could include jewelry, watches, rings, cell phones, shears, and knives. The second step is to inspect all protective equipment prior to putting it on to ensure that it is in good condition. This could include checking gloves to make sure that they're not ripped or torn, and to ensure that the PAPR is complete and working properly. After that, the crew will perform hand hygiene. Now that the crew has clean hands, they will put on their inner set or first set of gloves. After the inner gloves are on, you will now inspect your coverall to ensure that it is in good condition. After the coverall is inspected and is in good condition, the crew will put them on. After the suit is on, ensure that cuffs of the inner gloves are tucked under the sleeve of the coverall. Next, you will put on a second layer of gloves that we refer to as the outer gloves, and they will be secured in place with tape. Securing the outer gloves to the suit with tape ensures that the suit does not roll up the sleeve and expose the skin. The next step is to put on the PAPR unit. You will first start by inserting a charged battery into the unit. Next, secure the fan unit around your waist. Next, put on the hood unit. The hood unit should sit low on the head. You can adjust it by grabbing onto the sides and pulling it down and out to properly seat it on the head. Once the hood unit is properly positioned, use the cinch strap to make sure the hood fits snugly around the neck. It should not be so tight that it is uncomfortable, but not too loose that it does not create a positive pressure environment inside the hood. Next, attach the hose to the fan unit and turn it on. Ensure that it is functioning properly and is fully charged. After the hood is on and the fan is powered on, the support team member will check to ensure that everything is correct and working properly. A quick air escape check should be done to ensure that there is positive pressure inside the hood.
At this point, the crew will retrieve the patient, load them into the ambulance, and begin transport. During the time that the crew is in the facility, the support team will remove any equipment that is not necessary during the transport. The less equipment that's in the ambulance, the less there is to decon. They will use plastic sheeting to seal off the back compartment from the front cab if necessary. It's recommended that when it is time for transport, a support team member drives the ambulance and both crew members ride in the back. This helps eliminate contamination of the entire vehicle. If that is not possible, the support team will make sure that there are any cloth seats up front, they are covered in plastic and secured with duct tape. This will make disinfection easier as the plastic can be removed from the seat after the cab is disinfected, since we do not have an easy way to sanitize cloth seats. While the crew is dropping off the patient, the support team can begin disinfecting the ambulance. We now join our crew after dropping off their patient and returning to their vehicle.
Once the crew completes their transport and has returned to the ambulance, they are ready to be decontaminated and begin the doffing phase. Inspect the PPE for any visible contamination, cuts, or tears before removal. Any breakdown in the PPE should be noted and reported to the safety manager, clinical director, or on-call manager immediately. Perform hand hygiene and remove the outer gloves. All disposable PPE should be disposed of in biohazard waste bags. Reusable PPE should be placed in black trash bags for decontamination later. Once the outer gloves are removed, inspect the inner gloves and perform hand hygiene. The support team person will now disinfect the PAPR hood by using disinfecting wipes before the hood is removed. Start from the top, wiping downwards. To remove the PAPR belt and set the PAPR down in front of you. Lean forward, grasp the top of the hood and avoid grabbing the hose, and slowly remove the hood by pulling it off straight down to the floor. Place the PAPR contents in a designated container for disinfection. For us, that'll be a black trash bag. Next, everyone performs hand hygiene. The next step is to remove the coverall. Tilt your head back while unzipping the coverall. Unzip it completely before rolling it down while turning it inside out at the same time. Avoid contact with the outer surface of the coverall during removal, touching only the inside of the coverall. Dispose of the coverall in the biohazard bag. Next, you will disinfect the inner gloves, remove the gloves, and discard them, taking care not to contaminate your bare hands during the removal process. Dispose of these gloves in the biohazard bag. Perform one final round of hand hygiene and inspect your uniform for any contamination. Once the crew has removed all their protective equipment and decontaminated themselves, the doffing phase is complete.